to call you Chairman Becerra, General Becerra, and now Secretary Becerra. I appreciate your distinguished record of service, and of course, welcome back to the House of Representatives. When President Biden came into office in early 2021, I believe about only 2.8 million Americans were fully vaccinated against COVID at the time. Is that correct?
Less than 1%, that's correct.
And about 15 months later, how many Americans are fully vaccinated?
Over 217 million.
It's an extraordinary accomplishment. Does that happen by accident, or how did that actually occur?
It is neither accident or coincidence. It was a lot of hard work on the part of many of the people at HHS and throughout government, and a lot of the folks out there in the private sector and in local government as well.
None of my colleagues on the other side of the aisle supported the American Rescue Plan. How instrumental was the American Rescue Plan in helping to stand up a public health infrastructure with respect to both the vaccination accomplishments that you and others within the Biden administration are responsible for, as well as our general efforts at working through this deadly once-in-a-century pandemic?
Indispensable. Without it, hundreds of millions of Americans wouldn't have the level of protection they have. Hundreds of thousands of healthcare providers, doctors, nurses, hospitals, healthcare clinics would not have been able to receive reimbursement for some of the costs they've incurred to provide those services to Americans to stop COVID.
The American people are understandably fatigued as it relates to this deadly pandemic, and it's been with us now for 2+ years. And we've been through multiple variants, Delta variant, Omicron variant. Now we've got a subvariant, I believe, officially it's referred to, BA2, I believe. But this is still a challenge, and more than 900,000 Americans have been killed by COVID-19. That's an extraordinary amount of people. That's a lot of pain and suffering and death that have been experienced in every community across America: rural, urban, suburban, exurban, small town America, Appalachia. How should we be thinking about this moment that we're in as Congress is contemplating additional funding for the next phase of working through this pandemic?
Don't go AWOL. Not at this time. Not when we're so close. This is not the time to turn off the burners that let us go ahead and, as one of your colleagues said, Mr. Horsford said, to crush COVID. This is our chance to crush COVID. This is the wrong time to not provide the resources to crush COVID.
I agree. And in terms of the possibility, or at least the recommendation that I believe has now been publicly made in terms of perhaps the importance of an additional vaccination shot, certainly for people who've got pre-existing conditions that may cause a COVID infection to be far more deadly, and certain age groups, I believe now north of 50. Does the administration currently have the resources necessary to ensure, as has been done up until this point, that vaccinations are available for every American who chooses, who has the freedom of choice and exercises that freedom to get vaccinated?
We have fortunately made investments that allow us to have vaccines that we need for what we know we must do. But if we get to the point, for example, of requiring doses for the fall, another boost in the fall, we probably would not have the resources to provide that to all Americans if indeed FDA says it's appropriate to provide that to those, and CDC, I say it's appropriate to provide those all adults 18 and over, or perhaps even children as well. We would not have the therapeutic medicines that we need if we have another surge in the fall. We are running out of those resources. We did a lot of planning, so we have vaccines in place for those who need them today, but we don't have the resources, and therapeutics as well, and some of the testing, but that's going to quickly dwindle. And remember, we're at the front of the line in getting these vaccines, these therapeutics, because we made the investments early in big numbers. If we don't do that, we go to the back of the line.
And lastly, how important do you think making the investments in terms of the availability of therapeutics will be for us to get to a point where we can return to some semblance of new normal as we emerge from the current phases of the pandemic?
It's critical. It's the all the above approach, because certainly the vaccine are the best way to deal with this, because if you can prevent the contraction of COVID, that's the best thing. But if someone does get it, to keep them from going to the hospital or perhaps dying, the therapeutics are very important. And so all of that, along with the testing, along with the masks, along with the things that keep us safe, are critical to crush COVID.
Thank you, Mr. Chairman. And thank you, Mr. Secretary, for your testimony and for your service.
Thank you to you.
The gentleman's time has expired. Now recognize the gentlewoman from Texas, Ms. Jackson Lee, for 5 minutes.
Thank you very much, Mr. Chairman, and thank you, Mr. Secretary. It's a pleasure to be in the room with you. And let me